I want to thank the chair of the Public Health Committee.
Hold on, so we won't be able to hear you.
Okay.
So we move the microphones.
I don't know why they made me sit here. Go ahead.
Well, okay. Well,
She's loud. Go ahead.
So today we will be calling House Bill 7070, which addresses deceptive practices of crisis pregnancy centers here in the state. As everyone's aware, women's reproductive rights are under attack across the country. The anti-choice religious right has a strategy to go after women's reproductive health care in the courts, at the national level, and at the state level. And part of that strategy are crisis pregnancy centers. And so they have been in existence here in the state for some time now. And so we are very proud that today we can take a first step here in the state of Connecticut of stopping these deceptive practices. Women have a right to have access to all available information about their reproductive health care options. And deceptive practices at crisis pregnancy centers are preventing women from getting that information. We have, it is totally fine for a religious organization to have a nonprofit where they offer women services, but they cannot, and we will not allow them to, deceive women in order to prevent them from getting an abortion.
This will be the third time, I believe, that we're bringing this bill up. I'm glad to see that this is the year that we're hopefully going to get it over the goal line. We have said consistently that this bill is a consumer advocacy bill. We are really looking to make sure that women who are looking for health care are receiving health care. And the vast majority of crisis pregnancy centers will be unaffected by this bill, by this law, simply because they've been behaving appropriately. We are going after the bad actors and ensuring that women have the ability to see a healthcare provider when they're expecting to see a healthcare provider.
And I think it's important today to pay attention to the amendments that have been put on this bill. It's easy for us in Connecticut to think that women's reproductive rights are under attack in other states, like Alabama, but if you take a look at the amendments that have been filed, we know that there are individuals in this state on the other side of the aisle who are also going after women's rights.
Jonathan?
I'll just say that we're all familiar with the recently released analysis by U.S. News and World Report, in which Connecticut is ranked very highly in terms of health care. And one of those factors is access to health care. And as Representative Gilchrest said, this is really about access. Everyone deserves the right to be aware of all their choices. This is really a matter of empowering individuals to make the best choice for themselves. It's really not about a lot of the other subsidiary issues that you will hear when these amendments are brought out on the floor. It's really very straightforward. If you're behaving it properly, if you're a pregnancy center that is not using deceptive advertising to intentionally mislead susceptible women who are trying to make a choice, you have nothing to worry about. We're only going after bad actors, and that's what the role of government often is, to take care of people from the bad actors. And I would like to believe that we will never see another instance of deceptive advertising again, but the only way we can assure that is to protect people by empowering the Attorney General to prosecute those who engage in deceptive advertising.
How many crisis centers like this are we talking about at this point?
Well, there are certainly a good number of limited services centers in the state of Connecticut, but the ones that may be behaving badly, I couldn't tell you.
Some of the amendments.
Can anybody give me a ballpark figure on how many?
On how many? So the number of bad actors actually fluctuates. We have seen that once this bill went to committee and had a public hearing, that there were some bad actors who, after the testimony, or actually during the testimony, went onto their website and took down some questionable statements. So this bill has already shown that it has the ability to effectuate change, and we want to continue that and get it over the goal line so we can make sure that if there are bad actors that continue to deceive women, then we can go after them in the appropriate manner.
Well, not how many bad actors, how many crisis pregnancy centers are there in Connecticut?
So we believe 37, but I think we would want to double check that number.
Okay.
And let me be very clear. I have spent some time at crisis pregnancy centers. I actually have one in my district that I support. I have donated to them multiple times. And I've been there and I've heard their pitch and I've sat through and they're not a bad actor. And I support them and I will publicly support them. This isn't about all crisis pregnancy centers. This isn't about hindering freedom of religion. I believe in all that. I think the problem is when women are deceived into believing that they're going for a health care reason and they're kept there for religious reasons when that wasn't why they were showing up. And additionally, that if these pregnancy centers try to run out the clock so that they can't get the health care that they were looking for to begin with.
Can you address yourself to some of the amendments?
What's it again?
7070.
Thank you. Sorry.
That's right. So can you address yourself to some of the amendments that the sponsors say it's facially neutral, that would apply the same standards that you want to apply to the crisis centers to places that offer abortions? You know, it's similar language about advertising. So can you address yourself to that as to how that would undermine the availability of abortion services in Connecticut?
So I'll jump in.
Okay.
So there are already, so the major difference is that a Planned Parenthood, for example, is a health clinic. So it's a difference between a nonprofit organization and a health clinic. And so health clinics are already regulated. And so we don't need, there is no equivalent.
And
Well,
what
but
are,
if there's no equivalent, then what's the point? I mean, that's one of the things. What would they lie about?
About
what
offering health care services
that's
when
what
they
I'm-
don't.
Yeah.
If you
no,
want,
no. I'm asking about a Planned Parenthood clinic.
Right,
What
exactly.
exactly would they lie about?
there is nothing.
And they're already required to give women counseling when they go in to have access to an abortion.
so what are the amendments that you see as most onerous? That there's certainly a parental consent one, which has been an issue here periodically over the years. But what are the ones that you see as the biggest threats to the availability of abortion?
The most egregious I see today is that there's also a parental consent for emergency contraception, which is a high dose of birth control. And so to me, that sets the tone that the other side of the aisle is looking to roll us back even farther in the state of Connecticut with regards to women's reproductive rights.
Well, the entire other side of the aisle, or certain members in the Republican caucus? Because I mean, you know, that's a broad brush.
I
Guess
think
we'll
it's
see how the vote goes.
I think
Well,
it's
I'm
unfair
asking
to. I think it's unfair to say until we see the votes, until we see who is supporting what. I have not spoken to every single person, so I can't say that it's going to be fully along party lines. But we have had some female champions on the other side of the aisle, and I hope that they'll stick with us on this.
Do you guys have concerns about the lawsuit that was filed, a federal lawsuit against the city of Hartford on their ordinance?
Sure. Yes, I'll speak to that. We don't have concerns. We've been told by the advocates, we've been told by the mayor of Hartford that that's going to work itself out. And the Attorney General, in looking at the policy we're putting forward, doesn't see any reason that that lawsuit would impact this legislation.
Do you have anything in writing from the Attorney General that says that effect?
I can connect with the advocates to see if we do.
Okay. But you just said the Attorney General said, so how do you know that then?
I got that information through the advocates,
Oh,
and I'm
okay,
happy.
okay, all right, thanks.
Tell us more on the deceptive thing. Are you saying that these centers say that they have a doctors, nurses, or whatever on site? You mentioned something before that they don't even do healthcare.
Yeah.
So tell me, do they advertise? We have 3 doctors here, 4 nurses. What and what do they advertise, and what is the reality?
The real problem is the implication. The 1973 Consumer Unfair Trade Practices Act prohibits anything that implies that you have a service or a product that you don't have. So the implication when you have people walking around in white lab coats, they may not say, we have AMA certified doctors, but when you have people with stethoscopes or lab coats, that is the implication and the inference that is drawn by consumers. So this is where this becomes a consumer advocacy bill. And as with any business, these are businesses. Any business has to be honest and not bait and switch. So if you advertise that you are going to help somebody in a certain way, the implication being we have abortion services, and then the person is drawn in there and then discovers that in fact that product or service is not available, that's deceptive and that's a violation of this law. Some of these places even go so far as to copy the typography of nearby legitimate women's clinics. And again, this is all, it's all in the 1973 code. This is a violation.
Well, what would be illegal about using the same typeface? I don't really see how that is illegal. You're a lawyer. Please explain to me how that's illegal.
Well, you wouldn't. I mean, you would be unlikely to bring a case that's just focused on typeface, but it creates an overall picture. If it's using the same typeface, and you have the lab coat, and you have a stethoscope, and you have a form that looks like a HIPAA form, it draws a completer picture.
Is that because you wear a white coat? I mean, whenever I walk through the mall and I gotta walk through the cosmetic section, everybody's wearing a white coat. So,
Again,
I mean,
you can't
the
buy
wearing-
skirts.
Does the wearing of a
But you
white
buy
coat
makeup.
somehow play into the
It
advertising?
really does when you are, let's say you
I'm
went
just
up.
talking about, you're talking about advertising, and people wearing white coats when you show up, I don't know if that's,
Let's talk about, and
advertising.
maybe there's an advertising where someone's wearing a white coat and wearing a stethoscope and say, thinking about an abortion, come talk to us. That to me is deceptive.
It's my
But also you're
understanding
saying
it
that
was
the people-
language, correct, in some of the online advertising.
Absolutely, the language in some of the online advertisements are a problem, but I think that the good representative had a really great point. It's an overall picture, and so if we need to focus on the language, then we can do that. But we need to also say here, so you brought up HIPAA. That's a really great point, that if they are advertising to come in and talk about healthcare, when you actually get there, they're not bound by any HIPAA protections. So let's just say Amy wants to find out more about having an abortion, and they go to one of these crisis pregnancy centers thinking that they're protected by healthcare laws, and they're talking to people who do not have to keep any of this information confidential. And they're talking to them about things that they have no business talking to them about, and then to walk out the door, and Amy's healthcare information, the fact that she's pregnant, can be told to anybody. They're not covered by law. That's another thing that we need to focus on, is that this is when you look like you are a healthcare facility, when you advertise that you're a healthcare facility, but you're not bound by HIPAA laws, that's a very, very big problem.
And this is where context really matters. To Paul's point, when you're walking through a mall and a cosmetic counter, you're not thinking about getting an abortion. When you are a person in distress with a limited time frame to act, and you are in a, in situ, believing that you are in a clinic, that is a very different kind of deception. If you see a person walking down the street in a dark blue uniform with a badge swinging a billy club, most of us would assume that that's a police officer. You cannot impersonate a police officer. So the context of where these women are, the frame of mind, their biological imperative, has to be taken into account as well.
And the people with the stethoscopes you're saying is what? They're not even medical people? They're really nurses? They're not doctors? What are they? They're laymen?
Oftentimes they are volunteers.
Volunteers with no medical background. Is what I'm
Correct.
asking. Okay.
okay?
Is this going to be the call of the day, or do you expect to get to it at midnight?
Wait,
that's the next one.
Yeah, that's for them.
Is this gonna run as in the system, or is there an amendment, is there a strike?
No, I believe the bill is the bill.
Okay, good.
All right.
Thank you.